All right, boys, let's be real for a sec. Have you ever stood in front of the toilet and thought your junk just glitched? Like suddenly your body added a secret zipper inside your pee stream? You hear a click, then a sting, maybe a weird little pop. You look down and go, "Yo, what the hell was that?" If that's you, congratulations. You just unlocked a part of manhood no one warned you about. But don't worry, we got you. This video isn't just about pee sounds. It's about breaking that awkward silence around male health. The stuff guys don't say out loud but Google at 3 a.m. And if your urine has ever clicked, stung, burned, or made you walk out of a date holding your crotch like a war hero, you're in the right place. From urethritis to kidney stones, from pelvic floor tension to that ninja-level STI no one talks about, we're breaking it all down. No shame, no filters, just real talk about your real body. And by the end of this video, you'll know if that click in your stream is just muscle memory or a flashing red light. So sit down, relax, or better yet, stand up like a man who's about to understand himself better. Because this is Sit Here with Teenagers. And today, we're talking about why your pee sounds like a maraca. Like this video if you've ever had a weird pee drop, ouch, in the comments. If you're watching this on the toilet, subscribe because your body deserves better than guesswork. Okay, guys, let's get real for a minute. You go to pee. You expect it to be smooth, like water sliding down a slide at a summer camp. But instead, it's like click, click, maybe a sting, maybe a burn. And suddenly your whole body's screaming, "Danger!" You're in the bathroom thinking, what the heck is happening to me? Urethra attacked, bladder overloaded, prostate pressure. Let's pause for science. What exactly is clicking when you pee? Keywords explained. Urethra, the tube carrying pee from the bladder out. Think of it as your body's water slide. Prostate, a small gland that hugs the urethra. When inflamed, it squeezes the pipe like a python. Bladder, your internal water balloon, sensitive to pressure and irritation. Pelvic floor muscles, a network that controls flow. If tight or strained, you get spasms, jerks, even clicking. So yeah, it's not just in your head, you're not broken, but something is off. We spoke with several top-tier professionals to get real answers. Dr. Leah Moore, pelvic floor physical therapist. Men often ignore early warning signs, but just like cars rattle before breaking down, your body sends those clicking sounds for a reason. Listen to it. Dr. Raj Patel, men's health specialist. I always tell my patients, if your urination sounds like music, you're not in a concert, you're in trouble. Dr. Kevin Reese, urologist at Stanford Health. That clicking sensation, it's almost always a result of urinary flow obstruction or turbulence. Think of it like water hitting speed bumps in a pipe. It may be due to inflammation, prostate swelling, scar tissue, or even muscle spasms. Dr. Amy Tan, infectious disease specialist. STIs can present with almost no symptoms, especially in men. But by the time you feel something unusual, like clicking, burning, or popping sensations, the infection has already started damaging tissues. The culprits. 1. Urethritis, the itchy villain. You're 19. You just started college. Life is wild. You're sharing bathrooms, skipping sleep, and maybe experimenting. Fast forward a week. Every time you pee, it burns, like actual fire, and sometimes there's a weird click. Welcome to urethritis. Urethritis is when your urethra, the little tunnel that carries urine from your bladder to the outside world, gets inflamed. It can be caused by bacteria from poor hygiene, dehydration, or, more often than people admit, sexually transmitted infections. Most STIs like chlamydia or gonorrhea have an incubation period of 7 to 14 days. That means you can carry it and feel totally fine, until you don't. Real case. Alex, 20, from Chicago. I had 0 symptoms at first. Then, one day I went to pee and it felt like I was passing hot sauce. I also felt this tiny pop every few seconds during urination. I freaked out, Googled everything, thought I had kidney failure, turned out to be urethritis from chlamydia, and I didn't even know I had it. This is where things get spicy. Your body starts sending signals. Mild discomfort when urinating. Strange clicking, popping sensations. A weird pressure feeling right below the belly button. Itchiness inside the penis. Yeah, that's real. Some dudes even report a twitch in the pelvis, like a ghost trying to punch your bladder expert insight, Dr. Lauren Ford, infectious disease specialist. Urethritis is underdiagnosed because many young men think it's dehydration or just one weird day. Shit, but left untreated, it can lead to long-term damage like urethral scarring and even fertility problems. 2. Kidney stones, the pain pebbles. You wake up at 4 a.m. with this awful stabbing pain in your back. You try to pee, but the stream starts and stops with this creepy clicking sound. You look down. Your urine is red. Welcome to the world of kidney stones. Kidney stones don't show up overnight. They form over weeks or months when calcium or uric acid builds up in your kidneys, often because you're dehydrated, eating too much salty food, or chugging soda like it's water. Symptom: onset: sudden intense back or abdominal pain, clicking or bubbling when urinating, blood in urine, nausea or vomiting, pain that moves as the stone moves. Real case: Jordan, 25, construction worker from Texas. I thought I pulled a muscle carrying lumber, but then I went to pee and felt like my body was passing glass. I heard a soft pop every time I strained. CT scan showed a 3mm kidney stone halfway through my ureter. Dr. Marcus Bell, urologist, UCLA Health. That clicking you hear or feel during urination with a kidney stone is usually from turbulent flow, urine pushing around a jagged object. The body's natural design is smooth. When you feel or hear friction, something's wrong. 3. The prostate problem. Most guys under 30 don't even think about their prostate. It's like the appendix. We know it exists, but no one talks about it. But your prostate's job is critical. It produces seminal fluid and hugs your urethra. When it gets inflamed or enlarged, your pee flow gets funky. Types of prostate issues: prostatitis, inflammation from bacteria or stress; BPH, benign prostatic hyperplasia; non-cancerous enlargement; prostate cancer, more common after 50, but early cases do happen. Clicking or start-stop urination; weak stream, feeling like you can't fully empty your bladder; pressure in the lower pelvis; pain during ejaculation. Real case: Brian, 33, lawyer from NYC. I'd pee like I was leaking, not flowing. Sometimes it'd click, like something shifted inside. I thought it was stress. My doctor ran a prostate check and found early-stage prostatitis. A few weeks of antibiotics and lifestyle changes saved me years of pain. Dr. Samuel Green, men's health specialist. Clicking urination in younger men is often linked to pelvic floor dysfunction or prostatitis, but it's important to rule out prostate growth or infection early. The longer it's left alone, the more damage it causes. 4. Trauma or injury. Injuries aren't always dramatic. Sometimes you just took a fall on your bike or someone elbowed you during a pickup game. You brush it off, but weeks later you notice clicking when you pee. That's not just your imagination. It could be scar tissue forming in your urethra. Symptoms: clicking or popping with urination, difficulty starting or stopping flow, urine stream sprays or splits, mild burning sensation. Real case: Sean, 19, skateboarding accident. I hit my groin on a rail but didn't go to the ER. A month later, I felt like my pee had to push through a tube with rocks in it. Turns out I had a tiny tear that healed wrong, caused a stricture. 5. Trichomoniasis, the STI. No one talks about. It's not chlamydia, it's not gonorrhea, it's trichomoniasis. Most guys haven't even heard of it, but it's one of the most common STIs worldwide. And yes, it can make your pee click, tickle, or feel just plain weird. What is trichomoniasis? A microscopic parasite, Trichomonas vaginalis, transmitted through unprotected sex. It often causes no symptoms in men, but still causes inflammation. Symptoms in men: clicking or tickling sensation, discomfort while urinating, mild burning after ejaculation, thin discharge, no visible signs in many cases. Real case, Malik, 24, barista from Seattle. I had this annoying click when I peed. No pain, just a twitch. I ignored it for months. Then my girlfriend got tested. She had trich. Turns out I'd been carrying it and never knew. Dr. Elaine Cho, STD specialist. Trichomoniasis flies under the radar in men. It's treatable with 1 dose of metronidazole, but most don't get tested. And untreated, it can lead to prostatitis and infertility. Testing and when to panic. Let's be honest, if you've ever Googled your symptoms, you probably jumped straight from minor irritation to I'm dying tomorrow. That's just how WebMD works. But let's take a deep breath. You're not planning your funeral. You're just learning to listen to your body. And today, we're talking about how to tell the difference between I need water and I need a doctor. Now. Before we jump into symptoms and tests, let's talk about the elephant in the room. Most guys wait too long. Why? Because we say stuff like, it'll go away. Probably just spicy food. I don't want anyone touching down there. I'm too young for this. Real story, Ethan, 21, college student. I felt this strange clicking when I peed. Just a tiny tick, like something shifted. It didn't hurt, so I figured I was fine. Then a week later, it turned into a burn. Then came the blood. That's when I panicked and went to urgent care. They found I had a severe UTI that reached my kidneys. Ethan's story isn't rare. Many people ignore early warning signs until it's serious. So how do we know when not to ignore it? Red flag symptoms. When to book a doctor. Immediately symptom. Checklist. Pain or discomfort lasts more than 48 hours. Clicking plus burning sensation during urination. Blood in urine. Pink, red, or cola-colored. Fever, chills, fatigue. Discharge from the penis. Clear, yellow, green, or smelly. Pain in lower back or testicles. Constant urge to urinate, but nothing comes out. Pain during ejaculation. One red flag might not mean much, but stack 2 or 3, you're on the highway to a full-blown infection or worse. Your body's not being dramatic. It's giving you alerts. What happens if you wait too long? Here's what can happen when you ignore symptoms and avoid testing. 1. Chronic urethral strictures. Your urethra develops permanent scar tissue, makes urinating slow, painful, or impossible. May require surgery. 2. Kidney infections or sepsis. An untreated UTI can travel up to your kidneys. Worst case, bloodstream infection, Schrecker emergency room, plus fee antibiotics for days. 3. Infertility infections like gonorrhea or chlamydia left untreated can damage your reproductive system. That click you ignored could cost you fatherhood. 4. Prostate complications. Chronic prostatitis can lead to long-term pelvic pain, ejaculation issues, and bladder problems. Many conditions, especially STIs or early prostate issues, can be silent. You might feel okay while internal damage is happening. Real case, Daniel, 29, web developer from New Jersey. I went in because my wife was having symptoms. I felt 100% fine, but my test came back positive for trichomoniasis. I had no clue. I could have passed it to multiple partners before we even found out. Getting tested isn't about admitting you're sick. It's about showing you're responsible to your body, your partners, and your future. How to talk to your doctor without being awkward. Let's be real. It can feel weird to say, "Hey, I think my pee is clicking." But doctors have heard everything. Here's how to break the ice. I've noticed a weird sensation when I urinate, kind of like a clicking or pop. Moti, there's no pain, but it doesn't feel normal. I'm peeing more than usual, but not much comes out. There's some burning and a clicking sound, not sure what's going on. They'll take it from there. Let's walk through what actually happens when you show up at urgent care or your doctor's office for pee-related issues. Spoiler, it's not that bad, and no, they won't automatically stick a tube in you. 1. Urinalysis. Purpose: checks for signs of infection, blood, protein, white blood cells, or crystals. What it's like: you pee in a cup. That's it. Easiest test ever. Dr. Annika Green, MD, Family Medicine. Most diagnoses start with a simple urine test. We can tell a lot, from infections to early kidney issues, just from that golden sample. And no, color alone doesn't tell the whole story. 2. STI screening. Purpose: detects infections like chlamydia, gonorrhea, trichomoniasis, syphilis, or HIV. What it's like. Urine test plus optional blood test or swab. Real case: Jaden, 23, from San Diego. I thought I had a UTI. Nope, it was gonorrhea, and I would have never known if I didn't get screened. That clicking noise when I peed. That was my body trying to tell me I wasn't invincible. Most STIs are treatable, if caught early, but the longer you wait, the more damage they cause. Some silently mess with your fertility, bladder, or even your joints. 3. Ultrasound or CT scan. Purpose: detects kidney stones, bladder inflammation, or structural problems. What it's like: non-invasive, lie down, gel on your belly, quick scan. Dr. Raj Mehta, urologist, we use imaging when we suspect kidney stones or anatomical issues, like strictures. If you're hearing clicks and there's pain or blood, imaging gives us the full picture. 4. Prostate exam. Purpose: checks for inflammation or enlargement. What it's like: finger exam through the rectum, quick, not painful. Look, it's not your favorite moment, but it's fast, and it can literally save your life. Prostate inflammation can cause clicking, weak flow, and worse if untreated. Good news: most causes of clicky pee are fixable. You're not broken. You're not cursed. You just need to stop ghosting your body and start listening to what it's trying to say. Step 1. Stay hydrated. Dr. Eric Lohman, urologist at Northwestern Medicine. Up to 70% of urinary issues in young men are worsened by poor hydration. And ironically, most of them drink everything except water. Why it matters. Water dilutes urine, making it less irritating to the urinary tract. It helps flush out bacteria, toxins, and early infection particles. It supports healthy kidney and bladder function. Hydration tips that don't suck: carry a reusable bottle you like, one that fits your vibe, set phone reminders every 2 hours to sip, add lemon or cucumber to water for taste. Trade 1 coffee for water before noon. Step 2. Cut back on caffeine, alcohol, and spicy foods. Yeah, we know, nobody wants to hear this. But if your pee sounds like maracas and feels like it's passing through barbed wire, it's time to chill on the irritants. Why they matter. Caffeine and alcohol are diuretics. They make you pee more, dehydrating you in the process. They also irritate the bladder lining, making any inflammation feel way worse. Spicy food increases acidity in urine, triggering discomfort during urination, especially if you already have a UTI or urethral irritation. Dr. Kevin Baxter, MD, Internal Medicine. One of the first things I recommend for unexplained urinary symptoms is an elimination diet. Within 3 to 5 days of reducing spicy food, coffee, and alcohol, symptoms often improve. Step 3. Get regular STI screenings. No shame, just smarts. If you're sexually active, no matter how careful you are, you need to get screened. Clicking sensations during urination are common early signs of infections like chlamydia, gonorrhea, and trichomoniasis. And here's the kicker. Most men feel nothing until it's too late. Dr. Tanya Hill, STD prevention specialist. Getting tested doesn't mean you're irresponsible. It means you're aware, respectful of your partners, and invested in your own future health. When to get screened. Every 6 months if you're sexually active with multiple partners. After any unprotected sex. If you notice discharge, itching, burning, or clicking. If your partner tests positive. Step 4. Always pee after sex. It's not just for girls. There's this myth that only women need to urinate after sex to prevent UTIs, but men benefit too, especially if you're prone to infections, sensitivity, or weird urinary sensations. Why? Peeing after sex flushes out bacteria introduced during intercourse, prevents bacteria from traveling up the urethra, helps reduce inflammation from friction. Step 5. Don't hold it in. You're not a hero. Let's be real. We've all held our pee for too long. Maybe you're in class, driving, at work, playing video games, but holding your pee too long stretches your bladder and increases pressure on your kidneys and prostate. That pressure can inflame tissues and increase your risk for infections, not to mention trigger clicking, popping, and painful urination. Dr. Wayne Carter, urology specialist. Your bladder is like a balloon. Overfill it repeatedly, and it doesn't bounce back the same way. Over time, you can develop chronic retention issues, especially in men. Manage stress and pelvic floor tension. You probably didn't expect to hear about yoga or breathing exercises in a video about urinary clicking, but stick with us. Your pelvic floor muscles, the ones that help control pee, can tighten from chronic stress, bad posture, or even sitting too long. That tension can cause clicks, hesitancy starting urination, pressure or heaviness in the groin, incomplete emptying. Dr. Sandra May, pelvic health physical therapist. Men are often overlooked in pelvic floor therapy, but they suffer just as much from tight, imbalanced muscles, especially athletes, students, and people under stress. What helps? Pelvic stretches, deep belly breathing, not chest breathing, Kegel exercises, yes, for men too, but with guidance. Seeing a pelvic floor physical therapist if symptoms persist. Dr. Ian Berkowitz, MD, Men's Urologic Health. Most cases of clicking urination resolve within 2 weeks when we identify and treat the cause early, be it dehydration, infection, inflammation, or muscular dysfunction. Dr. Renee Doyle, Preventative Medicine, Mayo Clinic. Young men don't often seek help until the issue becomes painful, but symptoms like clicking are early warnings. If treated, they're reversible. If ignored, they can become permanent. We're going to break down real-life situations, and you're going to guess, normal or not normal. Grab a pen or use your fingers and count how many times you'd say, "I've felt that." At the end, we'll talk about what it all means. Scenario 1. Clicking with no pain. You're peeing and there's a light clicking or popping sound, but it doesn't hurt. You feel fine. It happens sometimes, not every time. Diagnosis: possibly normal. Explanation: this could be due to pelvic floor spasms, temporary urethral vibrations, or even air bubbles formed during urination. It can also happen if your pelvic muscles are tight from sitting too long or working out hard. Dr. Liam Cho, pelvic health specialist. A painless clicking sound can be a result of involuntary muscular contractions, just like how your eye twitches from stress. Unless it's paired with burning or pressure, it's usually harmless. Real case. Zach, 20, community college student. I notice this tiny click every now and then when I peed, especially after long classes. No pain, just weird. Got checked. Nothing was wrong. Doctor said to stretch more and chill on the energy drinks. Never heard it again after a week of yoga and water. Takeaway: if it happens infrequently, with no other symptoms, and goes away on its own, it's likely just your body adjusting or reacting to physical tension. Scenario 2. Clicking plus burning plus fever. You've got the clicking sound, but it's joined by a burning sensation, fever, maybe chills, or even back pain. Diagnosis: definitely not normal. See a doctor ASAP. Explanation: that combo screams infection, most likely a UTI, urethritis, or even a kidney infection. This isn't something you sleep off. The infection can travel from your urethra to your bladder and up to your kidneys, and then you're not just uncomfortable, you're at risk for sepsis. Dr. Angela Monroe, Emergency Medicine. Clicking plus systemic symptoms like fever means the body is actively fighting an infection. At this point, over-the-counter meds won't cut it. You need testing and probably antibiotics. Takeaway: clicking plus burning plus systemic symptoms. Go to urgent care, no excuses. Scenario 3. Clicking after heavy lifting or squatting. You hit the gym hard, deadlifts, squats, core. Then when you pee later that night, there's a light popping or clicking, but no pain. Diagnosis: usually normal. Explanation: lifting heavy engages your pelvic floor muscles, abdominal wall, and lower back. When overworked, they can spasm or create pressure on your bladder or urethra, causing sensations like clicking or a change in urine stream. Dr. Katrina Wells, physical therapist. Male lifters often hold tension in their pelvic floor without knowing it. That pressure can affect urination, even causing momentary clicking sounds. Takeaway: if it only happens after intense exertion and doesn't persist, it's probably mechanical, not medical. Scenario 4. Clicking plus dribbling or weak stream. You notice a clicking, but now your urine comes out slow or in two directions. You feel like you didn't empty fully. Diagnosis: not normal. Get evaluated. Explanation: this may indicate urethral stricture, scarring, prostatitis, inflammation, obstruction from infection or tissue swelling. These symptoms point to structural or inflammatory issues that require medical testing, especially if they happen repeatedly. Dr. Evan Morales, urologist. Flow changes are red flags. If your urine stream is altered and you're hearing or feeling internal resistance, like clicks or ticks, it often means the pathway is disrupted. Takeaway: changes in flow plus mechanical sensations. Get tested for structural issues. Scenario 5. Clicking, followed by painful ejaculation. The clicking isn't during urination, but it's there before or after ejaculation, sometimes with a burning tingle. Diagnosis: could be a sign of prostatitis or infection. Explanation: your prostate and urethra share plumbing. When one gets inflamed, everything feels off. Prostatitis can cause clicking during urination, pressure during ejaculation, pain at the tip or base of the penis. Dr. James Larkin, andrologist. Ejaculatory pain is never normal, especially if it's new or comes with other urinary symptoms. Inflammation, infection, or even nerve involvement should be considered. Real case. Nico, 30, photographer. I ignored the signs because I thought it was stress. Then sex started hurting and I heard a click every time I peed. It was chronic prostatitis. Took months to fully heal, but if I had gone earlier, it would have been a week-long treatment. Takeaway: don't ignore symptoms just because they're awkward. clicks paired with pain. Get evaluated. So let's wrap it up, literally. If you made it this far, give yourself credit. You just spent 2 hours learning about your body, something most guys never do until it's too late. That click, that sting, that weird something's off feeling when you pee? It's not random. It's not weakness. It's not something to ignore. It's your body asking for attention. Not panic, not fear, just awareness. Here's the truth. The strongest thing a man can do isn't hiding his pain. It's checking on it. Because whether it's an STI, inflammation, or just dehydration in disguise, your future self will thank you for facing it early. And if it turns out to be nothing, even better. That's peace of mind you earned by showing up for yourself. You're not fragile. You're just human. And sometimes human sounds a little clicky. This is Sit Here with Teenagers, where we say the quiet body stuff out loud. Drop your weird pee story, anonymous or not, in the comments. Someone out there needs to know they're not alone. Hit that bell so you don't miss the next brutally honest health breakdown. Share this with your roommate, brother, best friend. That guy who always says, "I'm fine."